in today's sessions, we'll be discussing on cleaning, sterilization, and disinfection. Those who have the textbook, please mention the page number in the chat box. Cleaning, sterilization, and disinfection. So, cleaning is the removal of foreign materials like soil or any organic material from the objects, and it is normally accomplished using water, even detergent, or with enzymatic products. Okay, depending on what you are using to clean. And cleaning is very important. Without cleaning, you can't send the instruments for CSSD, sterilization, or even high level disinfection. Though cleaning is required before any high level disinfection and sterilization, because of all the inorganic or organic materials that remain on the surfaces of the instruments, okay, they interfere with the effectiveness of the cleaning process. So if you need a proper cleaning to be done, you have to make sure, or even you need a proper sterilization and disinfection to be done, you have to ensure that cleaning is done properly of all the materials. There are four main methods of cleaning: manual cleaning, enzymatic cleaning, ultrasonic cleaning, and automated washers. So these are the four main types of cleaning, methods of cleaning. Manual cleaning, all surfaces, channels, boards of the instrument, they must be cleaned. You have to wear personal protective equipments while doing the manual cleaning. And through this, all the gross soiling is removed. Okay, the water's degree, the tepid water is little bit lukewarm water. Okay, so water's degree should be around 15 to 18 degrees Celsius. Okay, and before, when you're doing manual cleaning, if any equipment requires deconstruction, disassembling the instrument or equipment, that has to be done, and each and every part has to be fully immersed in any warm water, and you have to use a detergent in this warm water as well. Okay, a detergent that is biodegradable, non-corrosive, non-abrasive, and low foaming detergent ideally. Okay, all the visible soil should be removed as well. And after doing this, you have to dry the instrument for further procedures. Either you have to give it for sterilization or disinfection. So enzymatic cleaners, when do you use the enzymatic cleaners? When you have to sterilize or clean, give a high level disinfection for fiber optic instruments. Okay, anything that is hazardous, and these enzymatic cleaners are hazardous. And if you are using enzymatic cleaners, the healthcare worker should be very careful, especially when you are coming in contact with the enzymatic cleaners. This is how enzymatic cleaning you have to do. You have to wear a complete PPE while cleaning certain fiber optic instruments and all. Because enzymatic cleaners, if they come in contact with the skin, it could be it could cause burns, okay, or irritation, inflammation. So to avoid that. Then ultrasonic cleaners do not disinfect the instruments at all. They make sure that high frequency energy or sound waves are hitting the instrument in such a way that if it has any soiling matter because of this high energy sound wave, it will drop off. Okay. Any organic matter will automatically drop off, and that will make the rinsing process easy. Okay. Certain areas of the instrument where your hands cannot reach, okay, or any cleaning brush, etc., cannot reach, if the sound waves could reach it, automatically any soiling matter will drop off. Okay. And this is not appropriate for any cannulated instruments, plastic, two or more metals, some glass, syringes, lenses. Okay, for these kind of instruments, it is not suited. Daily efficacy test also has to be done. So this is how ultrasonic cleaners look like. They pass the sound waves, and because of the sound waves, any organic, inorganic matter would drop off from the instrument. Then you can proceed with the cleaning. Any automated washers, these are used for cleaning basic instruments. It cuts down the time of handling each instrument, because in automated washer, at the same time, numerous instruments can get cleaned. Okay. If you're doing manual cleaning one by one, you have to spend time on each and every instrument. It will be too time consuming. Okay. So automated washers will save your time. Must be compliant with you when you're using the automated washer. You have to be compliant with the national guidelines and the standards. Okay, you have to choose the automated when you're buying the automated washer for your institution. Choose it which follows the national guidelines and standards, and use it according to the manufacturer's instructions. This is how an automated washer looks like. Okay, n number of instruments, like a lot of instruments, different types of instruments can go together in this washer, and it will cut down the time of manual cleaning. Then sterilization, it describes the process that destroys or eliminates all forms of microbial life, and it is carried by in a healthcare facility, either through physical or chemical methods. Sterilization is done. Then all materials should be wrapped before sterilization. Only wrapped, packed materials should be described as sterile. So before anything you send for sterilization, you have to ensure some of these areas. The instrument that you are sending for sterilization, is it can it withstand the process of sterilization? Because in sterilization, actually when heat is used, okay, high heat, moisture, pressure is used in steam sterilization. So in that situation, can your instrument withstand the process? If is your instrument adequately cleaned, okay, before putting into sterilization, that is important. The instrument does not require any special treatment when sterilization has to be done. Does it require any special treatment? Then sterilization should be proceeded or not. That has to be checked. And records have to be maintained. Okay. Records of sterilization process has to be maintained so that you can trace the instruments which has undergone sterilization. So next is steam autoclave, methods of sterilization. Steam autoclave, steam under pressure, moist heat, hot air oven, dry heat methods, ethylene oxide, automated chemical systems, irradiation. Okay, these are the different types of methods available for sterilization. So in steam autoclave method or steam sterilization method, in which moist heat is used and steam under pressure is used. Okay. So this device sterilizes the instruments or other objects using steam under pressure. And the length of the time required depends on the temperature, vacuum, and pressure. Higher the pressure, higher the temperature, less amount of time. Okay. But if the temperature is low and the pressure is low, the time spent by the instrument for sterilization is higher. Okay. And this is one of the most efficient and most reliable methods of sterilization, achieving sterility. This is how an autoclave looks like. So these are the four principles that we use in an autoclave: steam, temperature, pressure, and time. Okay. So these are the important parameters of an autoclave. So types of autoclave, these are the different types of autoclave. Downward gravity autoclave. So here solutions can also be used to sterilize certain solutions. This can be used. Waste solutions instrument, okay, these can be sterilized, and then for example waste, sewage water and all, if it can be sterilized and then sent into disposal, it can be done. Okay. And any form of biomedical waste which following certain guidelines, it can be sterilized. Then self-contained autoclaves. These are office-based, small quantity, simple items can be sterilized. These are self-contained sterilization. So you don't have to send the instrument to somewhere CSSD. This small self-contained can be kept in one board. Okay, it can be used. Benchtop also. You don't have to wrap the items to do the sterilization, but you have to immediately use it after sterilization. So in ICU and all, ICU emergency departments, where you can't afford of wasting time to wait for the equipments to arrive to do some procedures. So that bench top is used. So they don't take any wrapped items. You have to sterilize the item as it is. As soon as the sterilization is done, flash sterilization is done, immediately use the instrument. Okay. Wrapped items, you can keep it. It has a shelf life. But unwrapped instruments, immediately you have to use it. Then pre-vacuum sterilizer. Clean instruments, gowns, towels, they can be sterilized, but it is not suited for liquid. Okay. Then dry heat sterilization, it uses high temperature to kill microorganisms and bacterial spores. Hot air oven and all. Okay. So hot air from here, it destroys it burns the cells of the bacteria. That is what the hot air does here. Okay, it burns the bacterial cells. That's how it destroys the pathogen. Okay, and some spores it cannot destroy, but majority of the spores can be destroyed here. So it should be used. When do you use the hot air oven? When you don't have things that uh, if it gets wet and it does not function, okay, those kind of instruments or items will go into hot air oven because you can't afford these items to get wet, like powders, oils, okay. The door unit should not be opened immediately. You have to allow the hot air on to cool down, okay. Otherwise, if any glass items is kept inside the hot air on and immediately if you are opening it, the gush of this cold air, it can break the sudden change the temperature from hot to cold can break the glass items, okay, or damage other items. So let the hot air on cool down and then you can open it. This is how the hot air on looks like. Next, you have ethylene oxide gas, EO gas, okay, ETO gas or EO gas. So it is used for sterilization of instruments which are made from heat labile materials, which means the items or instruments that cannot withstand heat at all. So for those devices, ethylene oxide gas is used, okay? Or any device that has some electric components. You can't put electric components and you can't expose electric components to high heat. Otherwise, it may lead to short circuit, okay? It damages the instrument. So for these instruments, ethylene oxide is fine. The time required to process the instrument, it is completely dependent on temperature, humidity, concentration level of gas, etc. The time required to process the instrument is dependent on temperature, humidity, concentration level of gas. And the gas that we use here should penetrate the packaging and it should reach all the surface of the instrument. Otherwise, the sterilization is not achieved. So time taken is around 12 to 24 hours. And since ethylene oxide is toxic, it is restricted in healthcare facilities. Okay, but pharmaceutical companies and all, you can use ethylene oxide gas. Next is automated chemical systems, hydrogen peroxide plasma. It is a fully automated cycle where you can achieve low temperature, low moisture sterilization within 45 to 80 minutes of the cycle. Okay. So here, this model of sterilizers are used. Again, in here also packaging is required. Polypropylene wrap or non-cellulose wraps is to be used to wrap the instruments and then do the sterilization. Because these things work at very low temperature, low moisture, okay, they take time to do the sterilization. If you're using the peracetic acid plasma, again, it's a low temperature sterilization because certain instruments, they cannot withstand high temperature. but they can tolerate low temperature. Okay, for those instruments, these kind of automated chemical system sterilizers are used. Okay, it will use peracetic acid of 0.2%. It's a high level disinfectant. Okay, sterilizer as well. And this process will require 25 to 30 minutes. So this is how it looks like. Then irradiation. Gamma radiation, it is available from commercial gamma radiation facilities. So how does it work? When a radiation hits the microbe or microorganism, it will convert the microorganism into a nanoparticle. Nanoparticles cannot infect, cannot cause any infection. Okay. Materials for packaging which is used are paper, non-woven papers, containers. Okay, so these are the materials used. Then the quality control parameters used, checklist, load number, load content, temperature, time of exposure, chemical or physical testing, biological testing, regular engineering and maintenance and documentation. These all are the parameters which should be mentioned on the sterilized item. Okay. Coming to disinfection, according to the CDC, disinfection is a process that eliminates most or all pathogenic organisms except bacterial spores. Disinfection is usually accomplished with liquid chemicals. High-level disinfection is capable of killing the bacterial spores, which is used in sufficient concentration for the required amount of contact time as well. Disinfection is not a sterilizing process, and it should not be used as a convenient substitute of sterilization. Disinfection cannot substitute sterilization. So these are the three different levels of disinfection: high level disinfection, intermediate level disinfection, and low level disinfection. High level, it destroys all the microorganisms except some bacterial spores. Glutaraldehyde at 2% and ethylene oxide gas are the examples of high level disinfection. Intermediate disinfection, it inactivates the Mycobacterium tuberculosis, most viruses, but does not kill all spores. Some spores it can kill, but all spores it does not kill. So alcohols, chloride components, hydrogen peroxide, chlorhexidine, glutaraldehyde. Okay, so these all are used in intermediate. Low-level disinfection kills most bacteria, some viruses, some fungi, but it cannot kill resistant bacteria. Okay, soaps, benzalkonium chloride. Okay, these are the examples of low-level disinfection. Thermal disinfection and chemical disinfection. In thermal, heat is used. Okay, all the items that can withstand heat and moisture. Okay, and does not require to be sterile. In that, thermal disinfection is used. Chemical disinfection, items that cannot withstand heat but need to be disinfected. Okay. So temperature, contact time, how long you will keep it in chemical disinfection. What is the pH of the detergent used? Okay. Resistance of the bioburden, these has to be analyzed. So higher the temperature, lower the time required for disinfection. Okay. Higher the temperature, lower the time required for disinfection. You can see it from the table. When the temperature is high, the time required for disinfection is low. If 90 degrees Celsius is the temperature of the water or detergent water, 1 minute is the time required to do the disinfection. Okay. If 70 degrees Celsius is the temperature of the detergent water, 100 minutes. Okay. So that is approximately around 2 hours. Okay, is used for disinfection. So again, the different levels of disinfection: high level, intermediate, low level. High level can inactivate all the microorganic microbial pathogens except some bacterial spores. Intermediate, all active microbial pathogens, again except for certain bacterial spores. And especially high level is used when you know that large number of bacterial spores are present, then high level chemical disinfection is used. In low level, it can just take care of some vegetative bacteria, medium-sized viruses, but not all bacterial spores, mycobacteria, fungi, okay? And all viruses cannot be disinfected using low-level disinfectant. Glutaraldehyde, it is one of the most appropriate form of chemical disinfectant that can provide high level of disinfection. And under very strict controlled condition, glutaraldehyde is used. Glutaraldehyde 2% is used. Okay. At least more than 20 minutes is the immersion time. Whatever instrument you are using to disinfect, okay, more than 20 minutes, it has to be in contact with glutaraldehyde. And before that, meticulous mechanical cleaning, that is manual cleaning, has to be done. Without cleaning, do not dump the instruments in glutaraldehyde solution. Cleaning has to be done. Okay. These are the some tables that you will find in the textbook. You can just read through that. Okay, different types of disinfectants used for different types of actions. Okay, sodium hypochlorite is used. 1:5 is the dilution rate. That is 1 part of sodium chloride in 4 parts of water. Okay, so this is the disinfection material used for blood spill, body fluid spill, etc. Bleaching powder, 70% is used to clean the toilets and bathrooms. Alcohol is used to wipe the metal surfaces, tables, tops, etc., where you cannot use bleach because bleach can change the color. Okay, so when you think the color would be damaged, so don't use bleach. Use alcohol, spirit. Okay, detergent with enzyme is used to clean all the fiber optic devices like endoscope, colonoscope, sigmoidoscope, etc., laryngoscope. And manual cleaning has to be done before detergent and enzyme. Chlorhexidine and alcohols are used even on skin. Okay, it is antiseptic. Disinfectant should not be used on skin. Antiseptic can be used on skin. Okay. Ammonia-based compounds can be used to clean dirty wounds as well. Okay. So that's about cleaning and sterilization. If you have any queries, you can mention.